Sleep apnea. There are a few needs that every human has in common. Those would include sleeping and breathing properly. But imagine not being able to do both. Some symptoms of sleep apnea include waking up with sore or dry throat, loud snoring, tiredness throughout the day, and morning headaches. Some more symptoms also include restless sleep, insomnia, so you can barely even go to sleep, and then being easily irritated. While asleep, people's lungs struggle to breathe and they become too relaxed, where their neck muscles, which might cause sleep apnea for them. The body ends up being deprived of oxygen while they're asleep, and that is the main issue of why sleep apnea is so bad for people. The endocrine system can be largely linked to sleep apnea because when cells do not respond to the hormone insulin, this can lead to type 2 diabetes. And you need sleep to do that. Also, the endocrine system can lack to produce hormones that help people sleep. Melatonin is a hormone, and some people do not produce enough of that, and that is due to their endocrine system not working functionally. Sleep apnea increases the chances for fatty liver disease and can increase heartburn. Not breathing well leads to restless sleep, and this can cause people to struggle to pay attention during the day and to stay awake. Basically makes them very tired throughout the day, and they usually have a lot of fatigue. Sleep apnea has been linked to obesity and high blood pressure. This can cause increased strains on the heart, which will end up making your heartbeat irregular. People with sleep apnea have to deal with tiredness or exhaustion during the day. They can usually get irritated a lot easier than most people, so this causes their day to be a lot more stressful. These people often wake up with headaches, which can be a negative way to start the day and often make it hard to be motivated to do a lot of things. Loud snoring is a huge symptom from sleep apnea, and this sometimes may cause people with sleep apnea to not, sleep with anyone else because people just don't, they can't stand being in the same room. Sleep studies are great ways to get people with sleep apnea the treatment that they need. These are done at hospitals where the patient sleeps and allows doctors to find out how they can help exactly and to ensure that they do have sleep apnea issues and to what degree they are at. A CPAP is a mask used for sleep apnea treatment, which assists the user in breathing while they're asleep. It just gently blows air through that tube, and this helps them breathe since they have a hard time doing it by themselves. Weight loss and doing things like quitting smoking and drinking alcohol can greatly reduce the terrible symptoms that come from sleep apnea. Just these changes to somebody's health make their sleep better and help their lungs function the way that they should. Being overweight is also heavily linked with breathing issues, and smoking is very harmful to the lungs. Being overweight puts you at much higher risk to get sleep apnea. Many factors can increase someone's chance to get it, but some people get it simply because their nervous system does not let them sleep well. It can be genetic, but not primarily. Usually it has to do with other factors, health factors. Oftentimes obesity is one. Narrowed airway is that's another huge cause for people to have sleep apnea, and some are just literally born with a thinner throat than others, and that means that they have much narrower airway. Some people also have a normal sized airway, but they have large tonsils or adenoids, and that makes it those just get in the way, so it makes it hard for them to breathe when they're sleeping. So sleep apnea is most commonly found in older people. Usually it happens to people above 40 years old. This again is just due to it being harder to be healthier when you're at that age, unless you're really trying to stay healthy. So usually above 40 years old, it's just more common for those people of that age to get sleep apnea.